Our grand challenge topic is virtual reality. While many people are familiar with virtual reality being the new experience applied to video games, Oculus setting the stage for this increase in popularity of virtual reality, there are many other applications that virtual reality can apply through experimentation and science. In this video, we will be explaining the methods of virtual reality in treating mental health. Our research question is, how does virtual reality play a part in mental health conditioning? Let's begin with some background on the basic technologies that go into the virtual reality experience. The virtual reality headset is mounted on the user's head and allows the user to look around the view with motion tracking technology. The game controller, such as an Xbox 360 controller, allows the user to further interact with the simulation just like in any video game. The scent machine works like an air freshener and releases scents relevant to the simulation environment. Haptic gloves allow users to interact with the virtual world with their hands using motion tracking and sensors. The gloves can also provide feedback such as slight vibrations to make touch more realistic. And finally, physical setups are very important to finalize a simulation, such as having a patient in a PTSD simulation hold a plastic rifle.
Next, we'll explain the correlation of virtual reality and mental health. Virtual reality exposure therapy, also known as virtual reality immersion therapy or just virtual reality therapy, has become a proven method to treat anxiety disorders. There are many different mental disorders. General anxiety and phobias are among the most commonly diagnosed. Typically, these disorders are treated by a technique called exposure therapy. As the name suggests, it involves exposing patients to their fears in a controlled environment. The psychologist leading the therapy session helps the patient confront their fears in a healthy manner. Virtual reality can be a useful tool for psychologists to increase the effectiveness of exposure therapy. Virtual reality allows patients to interact with their phobias in a virtual scenario, which can be closely monitored by the psychologist. A benefit of having a virtual scenario is that it can be adapted to fit the patient's specific needs. This adaptability can significantly enhance the therapy session and lead to more an effective experience.
Here are some real-life examples that incorporate the treatment of virtual reality. Traditional therapies of PTSD, such as imaginal exposure to the trauma, could be effective, yet most of the patients never seek for this treatment due to intentional resistance to go over their experiences the second time. VR technology, however, could facilitate high emotional engagement not only by enhancing the patient's imaginative and memorial capacities, but also augmenting them with visual, auditory, and even tactile computer-generated virtual experiences. VR may prove to be able to create a uniquely effective environment in which to process and integrate the memory fragments into a coherent story in the virtual world that the patients are comfortable processing. Virtual reality is also effective in alleviating the social stress and trauma from PTSD as shown in this video demonstration. It is exceptional because it could create an illusion to the patients that they are actually going over their unforgettable situations and problematic experiences again in the real world by simulating the camera with their head movements.
We were also able to find an abstract on the use of VR with public speaking. We thought this could be a relatable application of VR therapy. Many of us university students can relate to experiencing anxiety or fear of public speaking. There was a research program that investigated the effectiveness of virtual reality therapy, VRT, in reducing public speaking anxiety of university students. The students were measured on 4 self-report inventories: self-report of subjective units of discomfort during exposure to VRT, and physiological measurements of heart rate during speaking tasks. They went through 4 weekly individual exposure treatment sessions for approximately 15 minutes. Results showed 4 out of 8 virtual reality treatment sessions were effective in reducing public speaking anxiety in university students. This goes to show even mental discomfort that are closer to our own personal experiences can be alleviated with the use of VR. There are many other mental disorders that VR is being applied to as we speak. Any psychologist will tell you how many different mental disorders they encounter. However, this is still not a perfected method. There is technology waiting to be developed or improved to making this experience more effective. In conclusion, virtual reality isn't perfect, but it is a start.
Studies show that VR environments can elicit psychiatric symptoms. Manipulation of VR can inform the understanding of disorders, and simplest psychological treatments can be successfully administered in VR. It is, however, still relatively early days with VR for mental health. Specialist programming expertise is still required to create suitable environments that lead to presence.
Simulator sickness may occur in poorly realized scenarios and systems. Multisensory presentation of stimuli is most likely to induce presence, but generalized touch feedback, that is tactile simulation on a part of the body contingent on collision with a virtual object, is not feasible at present.
Mental health is an important matter. With more investment with this kind of technology, there could be a more effective way for combating mental disorders.